Hello, I'm Dr. Brandt Gibson, and I want to talk to you today about posterior tibial tendon dysfunction, and I'm going to do that by answering the 4 questions again. So posterior tibial tendon dysfunction, what is it? It is a failure of the posterior tibial tendon. Posterior tibial tendon goes on the medial side of the inside of the ankle and extends down to just around the arch area. And in this area, what its job is, it actually helps in the functioning of the foot. When you go up on your toes, for example, it turns the heel in to improve the stretch of the Achilles tendon and allow it to function like it's supposed to. When this posterior tibial tendon starts to fail, the foot will flatten out, the arch will flatten out, and a lot of times you'll have issues where you have difficulty using the Achilles tendon. You're not able to get up on your tiptoes, for example, or you have weakness and can have actually pretty significant arch pain and so forth. So this is posterior tibial tendon dysfunction. Why does it happen? The most common reason for this to happen is injury, where you actually do something that you strain that tendon and it gets painful and tender and so forth. The second most common would be based on the gait pattern, the way that you walk. Gait is that process of how you walk. And if you're walking, so you're pronating a significant amount, you're actually putting significant pressure across that posterior tibial tendon. That can cause it. If you're excessively supinating, can also sometimes cause it from overworking that tendon in certain situations. Certain types of shoes can cause it. And definitely, of course, certain activities can actually cause it. So 3, what can you do for it at home? The best thing to do is to find some kind of a support, arch support, or bracing that will actually pull up or hold the arch up, to take the pressure off that posterior tibial tendon, and rest. As with any tendonitis, any tendon that's starting to fail, you can rest it, you can ice it, you can compress it, do splinting or something to keep it from swelling, and elevation, again, it decreases swelling. Controlling the activity levels can also help this. If you're doing things where you're continually stressing it, continually moving it, that can lead to additional pain and additional problems. Number 4, when should you see the doctor? As with everything else, if the pain is not getting better, or if you're saying, okay, I'm having issues and it's not working and I need some other options, or I want to confirm that's really what it is, you should go see a doctor. And a lot of times you can get into custom orthotics, which will solve the problem. You can get into certain types of braces that can solve the problem. The whole idea is to take the stretch off the posterior tibial tendon and allow it to recover. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day